Hi, as a follow-up to our previous conversation about a code STEMI, I received a couple of phone calls about a left heart cath and maybe some more details on it. So I thought I'd do is show you how long it takes you to get, say, from like Fondren and Westheimer to the emergency room door. Then we'll come back to the office and I'll show you a few details about the left heart cath. Okay, we're here at the intersection of Fondren and Westheimer. And it's in the afternoon, so traffic is heavy. You're having chest pain, and Mr. Edmonds has already started the clock. And what we're going to do is drive over to the emergency room. The next shot you'll hear, the next shot you'll see is me turning into the emergency room at West Houston. So it's Fondren and Westheimer, and you take your 2 nitroglycerin, you take your 2 aspirins, and you head over to the emergency room, and that's what we're going to do right now. So we're here at the West Houston's Medical Center Boulevard. We're going to take a left, and you can see the hospital in the back off of Westheimer, and it was roughly 10-11 minutes to get here, and it'll take us another 2 or 3 minutes to get to the emergency room door. So it took us roughly 15-16 minutes to get to this point. You'll park right here, even though it says handicap. I mean, if you think you're having a heart attack, you don't waste any time. You go right through that door, you tell them you're having chest pain and that you think you're having a heart attack, and then we'll proceed with a code STEMI. We're going to break over to my office, and I'll give you a little bit of a detailed outline as to what a heart cath is all about. Okay, so we've shown you how quickly you can get to the emergency room from the corner of Fondren and Westheimer, and at the previous episode I showed what happens to you in the emergency room, where you get your EKG in under 5 minutes, a code STEMI is called, and then you're taken to the cath lab. Now, the question that was asked of me is maybe a little more detail of a heart catheterization that was previously talked about. And if we'll step over here, this is kind of a model of a patient and gives you an outline of the arteries of the legs that go to the heart. The arteries come from the heart, but when we do a heart cath, we deaden the groin in this area with a local anesthetic called xylocaine, and we pass a catheter up to the arch of the aorta, to the origin of the coronary arteries. For example, here on this model, you'll see the right coronary artery coming off the aorta, and so the catheter comes up the aorta, and we inject dye both into the right and into the left coronary artery. Now, if we discover that there is an obstruction in the code STEMI, which is an acute heart attack, what we would do is we get a wire across it, and we would balloon it, and after the ballooning, we would then place what looks like here a stent. We inflate the balloon a second time with the stent and deploy the stent, as you see here, and remove the balloon and the wire, and blood flows again. This model shows the artery blocked. If we get the wire across it, dilate it with the balloon, and then deploy the stent, then what you have is blood flow across the obstruction with the stent up against the wall of the heart. This model kind of gives you an inside view of what that obstruction looks like. If you were looking at this one, it would be like this. You have an obstruction here. I get across it, open it up with a balloon, deploy the stent, and we get blood flow going across. So the key thing is to get to the emergency room quickly, so that way we can get you to the cath lab and deaden the skin, pass the wires and the catheters and the balloons and the stents to stop the heart attack. And that's what a code STEMI is all about. Thank you.